Okay, so let's go to section C. Section C. A 60-year-old man was admitted to the world with volvulus, which has caused intestinal obstruction. He is admitted in preparation for a surgical procedure. What are the signs and symptoms of intestinal obstruction? Outline the preoperative care that this patient will need before surgery. State the preoperative, state postoperative care after surgery. Identify 5 nursing diagnoses pre and postoperatively. Okay, you know what? I will allow section C. You guys should go try and do it tomorrow. When we come tomorrow, we'll correct the assignment. Then I will say everything I'm supposed to say for that section C. So then tomorrow we'll continue. When we have done it, then I will. For now, let me just touch part of it. So now we notice that they are telling us what are the signs and symptoms of intestinal obstruction. They just want you to state the signs and symptoms, right? What are the signs and symptoms? Right, abdominal distension, abdominal cramping. You can see stool. You can see blood in stool. Right. You can see constipation comes in, vomiting, nausea and vomiting, distended abdomen, abdominal cramps, abdominal pain. We have nausea and vomiting as the first symptoms. We have abdominal pain, excruciating abdominal pain. You can see diarrhea or blood in stool. You can see abdominal distension as a symptom of an intestinal obstruction. You can see things like body weakness, general discomfort, and all of that. So those are some of the symptoms that you have with patients that are experiencing intestinal obstruction. Right? Anything they take in, they throw it out because the intestines have been closed, or they start experiencing constipation. Right? You can start seeing general body discomfort, an increase in body temperature, right, in that particular area of the body. And so they're asking us to identify preoperative care of this patient, what this patient will go through before surgery. Now, if there's preparation for a patient before the person goes into the theater. Now, the preparation is the psychological preparation, there is physical preparation, there is somatic preparation, there's really religious way of preparing patients to go in for surgery. It goes with medical preparation, right? The area of the operation is supposed to be kept clean, maybe shaved, clean. Patient administration of anesthesia and some medication, some drugs, right? Antibiotics. Prepare the patient. Let's say if the operation is that serious, 24 hours before the time he or she should not eat, right? So that they should reduce peristaltic movement during the operation. You 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 if the patient wish to pass confession, maybe as a Catholic Christian, you can encourage that. If the person wish to talk to their imam to respect their God, you send them. If it's a person is a Pentecostal, their pastor, they can talk to their pastor. That's spiritual preparation. Then you must do psychological preparation in that you talk to the person because everybody who goes to theater, most often at time there's a myth that, oh, I will die. What will you do? You tell the person that they are experts in the theater, right? That, oh, the team that we have in the theater there, they are experts, that are masters. They have been doing this thing for long. And so God will help us. Don't give the person false hope. He or she can die in the course of entering the theater. So God will help us, right? You bring things, let the person know that they are experts that will be taking care of him. And the aim of those people is to see that he or she is brought back to life. Though mistakes can occur in the theater, and those mistakes can lead to the death of the patient. But now, let your statements not be, don't give too much hope, right, to the patient, right? But say it in a way that it can be best understood. That, oh, God will take charge of us, and we wish that you will come back safe and sound. Explain the procedure to the patient, signing of the consent form, administration of medications, monitoring blood pressure, signs and symptoms, monitoring, reassuring the patient. Then you carry the patient down to the theater. Those are the physics. Those are the ways you can prepare the patient for operation. Then they are saying post-operative nursing care, right? Most often at time, even before the patient is going to the, especially those for intestinal obstruction, they place an NG tube, right? They place even a catheter, right? And then state post-operative care after surgery. What are the things you will do after the patient has gone to the theater? What are the various procedures? What are the various things you will do after he or she has come out from the theater? You monitor your vital signs, administer drugs as prescribed, place the patient in the right position of sleeping, measure temperature often, place, draw and let's say an input and output chart that indicates the quantity of water the person takes and the quantity of water that goes out, hygiene of the patient, right? Dressing of the wound area, monitoring the wound area for any form of infection, right? Look at how the patient is recovering from anesthesia. Because most of the time, place the patient in the right position so that some of the sputum is coming out because most of the side effects of some of these anesthetic drugs, it causes sputum coming out from the mouth, especially when the patient is just from the theater, right? You do that, manage the patient properly by placing the patient in the right position, depending on where the operation has been carried out, monitor the patient for pain because most of the time when they come back from the anesthesia, when the person is recovered from anesthesia, he or she can start experiencing pain, right? Administer analgesics, administer antibiotics, monitor the patient, place the patient in the right position. And the patient has recovered and the patient is hungry, you can give the patient food. So those are the ways you can manage the patient from post-operatively, right? That's 5 marks that you get. So you must talk well, right? You must talk well. You must give reasons why they should give you the marks. Administration of drugs as prescribed, reassuring the patient, educating the patient, right? Monitoring blood pressure, administering analgesics, placing the patient in the right position after surgery, checking or examining the wound area for after 24 hours after the surgery has been carried out for dressing and for proper management of the wound, right? Self administer drugs as prescribed, monitor vital signs, monitor input and output chart, monitor what the person takes in and what goes out, find out for any abdominal or peristaltic movement. Has the person passed out air? Like has he or she defecated? Or have you noticed any abdominal, any peristaltic, any intestinal movement which could result to passing out of air either via the anus? And if the person experienced any passing out of air, that's to prove that there is peristaltic movement, to prove that the operation was carried out properly. And then if it was done, how was it? Was it offensive? Was it smelling? How was it like? And the patient defecated. How was the physics like? Was it reddish? Was it bloodish? Was it anything? Just you document, right? Document everything you have carried out. So the next question 2 is emphysema is seen one of the respiratory tract infection that causes individuals to be admitted to the hospital. Emphysema is actually a condition in which it's an autoimmune condition in which there is damage of alveoli cells, whereby the alveoli, that's the area where gaseous exchange occur, whereby a person takes in alcohol, smoking, right? The action of the discuss the pathophysiology of the condition. How can it be diagnosed? Outline both medical and surgical and that. Now, so you guys tomorrow will continue from there. Then hypertension is one of the most common risk factors to many cardiovascular diseases plowing our communities today. The patient is admitted with a blood pressure of 210, who is complaining of headache, blurred vision, dizziness. He has been placed on a series of medications. See the different drugs used for the management of this condition, right? State the different drugs, state the different drugs used for the management of for the treatment. with their mode of action. So what they want you to do is just take the classes of drugs, right? Diuretics. Diuretics is to water loss, angiotensin converting enzyme inhibitor. But what does it do? Retain sodium, right? In enable the excretion of sodium and the retain of water, because most often at time, or it can also cause the water out, because most of the time most hypertensive patients also have edema, and they have some type of edema, like they have water retention in the body because it depends on sodium. Knowing the way they salt, you always have water. So all of that. Tomorrow we'll discuss that at length. Prepare a nursing care plan for a patient with hypertension. Prepare a nursing care plan for a patient with hypertension. So take note of that. So tomorrow we are going to continue.